Our very first champion was is our pediatrician, just because he was willing to confirm the diagnosis. He was willing to support whatever we wanted to do. In all of his years of medicine, at the time it was 30 years, I think 35 years, and all of his years of medicine, he had had a couple other trisomy 18 patients, and Elijah was completely different. And so he was very much open to supporting um, any conversations that we wanted to have. So he was our very, very first champion. And then we were connected with a plastic surgeon, a craniofacial specialist for his bilateral cleft lip and palate, who became the ultimate champion. We were connected with him because of an urgent. It was an acute situation, um, um, and it was one conversation with him, and he said, "Have you seen a geneticist?" No, we haven't. You have a genetic condition and you haven't seen a geneticist? He made a phone call, connected us with genetics. That connected us to ENT and audiology and speech, and we were denied newborn screening. We were told that newborn screening wasn't necessary for Elijah. But after being connected with all these other doctors, we began to uncover diagnoses that newborn screening could have found. From hearing loss and all these different things. It was just that one doctor, our plastic surgeon, he connected us with so many other people, and that led us to nephrology for Elijah's kidney. He has one working kidney, cholestasis, just a bunch of different things. Our nephrologist, champion. She connected us with rehab medicine. She connected us, and it's those champions who connect us to other champions who really care about Elijah's care. And now we have a team of people who they will work it out, for us to see several of them on the same day. Because we make a 2-hour drive, they will work with each other and say, okay, so I see you're coming this day for this, and I see you're coming this day for this. Let's put those appointments together. It'll be a long day, Mom. And I'm like, you know what? If it's going to keep me from having to make multiple trips, let's do it. And we, of course, make sure not to overexert Elijah, but but it really all started with, aside from the pediatrician, it started with our plastic surgeon, our craniofacial doctor, and he just slowly just kept plugging us into people. And to this day, he is a huge, huge champion and advocate for Elijah. They 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 are ready to fight for him if we ever need it. With one working kidney, we were concerned if he ever needed a kidney, they're gonna shut us down because of this diagnosis. And they're like, no, we'll fight it. Like, just very, no, we'll fight it. Those are the folks that we want to work with. So yeah, we've got some amazing people now, who really, really root for him, and root for us as a family. They help us know things that we wouldn't know, watch for things that we wouldn't know to look for, because we've not had a child with a special health need before. And so they prepare us. If this happens, let's do this. If this happens, watch for this. Is he doing this? Simple things like sounds, beat, ba ba and da da from his cleft repair. Right. Things that we would just probably dismiss. They help us be on top of that. They ask us questions, we ask them questions, we have conversations. Oh, right. Yeah.